So diabetes in the developing world is a very interesting phenomenon because the old classifications of diabetes as clearly type 1 or type 2 really don't apply, or at least don't as clearly apply. The idea of malnutrition diabetes, or type 3 is what's called here, is an increasingly recognized issue, and one of the major problems with it is that we don't have, and it has not been appropriately investigated because we don't have, and nobody's had, the means to investigate it to really figure out what it is. It's a whole other category, but personally I think it's a very exciting category because I think that when we investigate it more thoroughly and are able to do some of the tests which we hope to be able to do with patients that we suspect of having malnutrition or type 3 diabetes, we may start to understand the other types of diabetes which we've traditionally thought we've known a lot about, type 1 and type 2, and perhaps even figure out more clearly the cause, for example, of type 1 diabetes by looking at the cause of something like type 3 or malnutrition. I really think that there's an undiscovered link between these, and the studies just have not been done yet to really investigate that thoroughly.
An autoimmune link?
I think that there might be an autoimmune link. There may be a infectious agent perhaps relating to this type 3, this malnutrition, some sort of overlap with your traditional autoimmunity as we think we know about it in type 1. You know, it's not something that we see in the United States, or if we do see it, we don't recognize it, and we're not diagnosing it. So I suspect that learning more about malnutrition and type 3 will also help us to learn more about type 1 and type 2.